Hello, I am Dr. Carolyn Eaton, and this week in medicine, I am talking about COVID-19 treatments. We had some very good news recently, and that finally something has been shown to reduce the death from COVID-19, and that is a medication called dexamethasone. Dexamethasone is a medication that's been around for about 45-50 years. It is commonly used for people getting radiation treatment to reduce the inflammation from getting the radiation. So it reduces inflammation in the brain and the spinal cord around the bones, reducing pain and reducing swelling. It is also commonly used in people with lupus and rheumatoid arthritis when they have a flare of their underlying disease. And so it's a very strong anti-inflammatory. And what it does is it's reducing that storm, that cytokine storm we've been talking about, and people are better able to live. And people who are intubated and on mechanical ventilation reduce the death by about 1/3, and the people just on oxygen are reduced death by about 20%. So that's excellent news. We finally have something that can help. The second medication that has actually been approved is remdesivir. Remdesivir is an antiviral medication that was originally developed to treat Ebola. Now, Ebola is a virus that is mostly in Africa that caused a hemorrhagic fever. People would start bleeding internally. And the medication developed for it apparently has some cross-reactivity towards the towards the coronavirus, even though it was not originally made for the coronavirus. But on that study, even though there was a slightly lower death rate in the patients given the remdesivir, it did not meet what's called the statistical significance. So it does look like it improves things. It definitely improved time to recovery for patients who are very sick. It was also, again, only used in people who were very ill, and it did show to have some improvement. So that's a very, very good news as well. Now, the next couple of things I'm going to talk about have had only very small studies, so none of the studies have reached statistical significance enough to say that, yes, they're definitely helpful, but the indicators from the smaller studies are that they need to be studied more so we can see if they will then become part of our armament for treating this disease. This next segment, I'm talking about medications that have had only very small studies. So we don't really know if they're truly going to be effective or if the beneficial effect was just by random chance. We call that statistical significance. There needs to be a large enough study to show that the benefit that the medication has is not just by random chance. Now, the first of these I'm talking about is one called mavrilimumab. Mavrilimumab, quite the mouthful, is a granulocyte macrophage colony stimulating factor inhibitor. So yes, that quite big mouthful. The GM-CSF inhibitor blocks the inflammatory pathway. And so it keeps some of the inflammatory interleukins from being developed that then in turn cause that cytokine storm. And so by blocking that inflammation really early in the pathway, it blocks the clotting and the inflammation and the fluid developing in the lungs as much, and improves survivability of the infection. And what this study was done, it was a very small study. Only 12 people were treated and 26 in the control group. Of the 12 people being treated, and these are very sick patients who were intubated or in the ICU requiring oxygen, and none of those 12 people died. And so that's a very promising sign. About 7 of the control group died, so that was about 27%. So a very good indication that this may be something beneficial and is then requiring further study to see if it really is and if it's worth developing. The downside of mavrilimumab is that it still is an experimental drug, and so it does not have an underlying production pathway to help make it quickly and easily available to everybody should treatment be needed. The next treatment I want to talk about is convalescent plasma. This is where they take the blood from a person who's survived COVID and recovered and then put it into a person that is still suffering from it and still very sick. And by getting the antibodies from the person that has recovered and putting them into the sick person, hopefully that will help stimulate their immune system and help fight off the infection so that they can get better. This is a treatment that goes back over a century. For that matter, they were using convalescent plasma in patients suffering from the Spanish flu of 1918. So this is a very old treatment. It has had a good long history of effectiveness. Now, the large studies to show that it is effective for this particular infection are currently ongoing, but the earlier indications are that it has some benefit. So if you are somebody who's recovered from COVID-19, then donating your plasma to help treat somebody who's currently suffering from it can be a very, very helpful thing. And I encourage you to go out and donate, please. The third of the experimental drugs that look promising segment is on something called thymosin alpha-1 peptide. Now, it is actively used as a hepatitis B treatment and has been shown to be very effective for this. And what the thymosin is, it's a naturally occurring peptide that helps upregulate T cells in your body. And we found that people who are very, very sick and people who have been chronically exposed to the virus and their body's trying to fight the virus, sometimes their T cells become fatigued. And what happens with the thymosin is that it actually helps upregulate those T cells and help make them more effective again. And I slightly misspoke in my, when I talk about my virus response talk, in that I said that your thymus was completely and totally dead after puberty. It turns out it retains a slight residual amount of activity, about 2 to 3% of its most active state, up until about the age of 65, in which time then it really is completely gone. And the thymosin also will help slightly upregulate that residual amount of thymus to help, again, make more and help upregulate the thymus gland so you can make more T cells and help fight off infection. And this study was done in Wuhan, China, and in the study group, there's only 36 that received treatment. Of them, only 11% of the actively treated patients died versus 30% of the control group that died. And so that was a very strong response. Again, it was a very small study, so it needs a much larger study to show that this is going to be an effective treatment. The plus of that, the thymosin alpha-1, is that it is an available treatment. It is something that already has a production line and could be upregulated very quickly should it prove to be effective. And so that's another very promising one. Now, the next section is on things that have not really had any studies done, but are very safe and effective things for other types of viruses and may be helpful for a person fighting more mild forms of COVID or an adjunctive treatment for people who are currently in the hospital and fighting COVID. Now, of these types of treatments, the first is zinc. Zinc has been used against colds for many, many years now. We have found that taking zinc about 75 milligrams a day in divided doses, that means 2 or more times a day, at the onset of a cold can help shorten the cold by several days and shorten the severity and reduce the likelihood of developing a sinus infection. And several studies have been done against rhinoviruses with zinc. Now, there are no studies that I could find specifically against coronaviruses with zinc, although coronaviruses are a common cause of upper respiratory infections. And so it may be helpful. Now, what dosing you would need, if you have a known exposure to COVID, it would be about 75 milligrams a day for 7 to 14 days. You don't want to go more than 150 milligrams a day, 150 milligrams a day for more than about 2 to 3 weeks, because then you could start risking zinc toxicity, which would be manifested as abdominal discomfort, diarrhea, nausea, vomiting, any of those things. Now, sometimes people can have a little bit of loose stool, even the 75 milligrams a day, but that would not be surprising. But that's actually been shown to be helpful for colds. And also, higher doses of zinc have been shown to reduce your good cholesterol, your HDL cholesterol. So again, you don't want to take high doses of zinc for prolonged periods of time because that has other negative effects on your body. Safe dosing of zinc for just day-to-day supplementation, 40 milligrams or less per day has been shown to be safe, but has not really been shown to be effective at improving your immune system or reducing colds. So if you do get an exposure, or if you start feeling like you have a cold, then taking 75 milligrams a day of zinc can be helpful. And the last one I'm going to talk about is vitamin C. The reason, and it's very specifically IV vitamin C for people who are hospitalized, mainly because IV vitamin C has been shown to reduce death in patients suffering from sepsis. Now, sepsis is a bacterial infection in the blood that oftentimes can cause death. Now, people will get pneumonia or some other kind of infection. It gets in the bloodstream. It causes the blood pressure to fall out. It causes this whole cascade of very negative things, including multi-organ failure. And vitamin C has actually been shown to reduce death from sepsis, bacterial sepsis, by about 30%. And since severe forms of COVID-19 also have a lot of resemblances to bacterial sepsis, it may be very beneficial to use IV vitamin C. And IV vitamin C has not been shown to have any significant toxicity, and and it should be safe and effective. And so there's really not a lot of downside to adding vitamin C IV to the COVID-19 regimen that people are undergoing treatment for in the hospital. So should I develop COVID-19 and have to be hospitalized or on oxygen, it would be something that I would ask for added to my regimen. Of course, would I love to get mavrilimumab? Absolutely, because that looks among the most promising of things. But definitely, we have ongoing studies, ongoing treatments, and hopefully we will get this all figured out very quickly so we can all go back to having a regular life and not be out in public with masks. Though, for right now, please be out when you're out, wear your mask, because that has been shown to really significantly help reduce the spread of the COVID-19. And please just do that. It is a simple measure. They're not the most comfortable with, especially when the weather's hot, but it really helps reduce the spread. So please protect yourself, protect your friends, protect others that are in your neighborhood, and wear your mask until we have better treatments so we can cure this and get on with our regular lives. Thank you for your time. Have a lovely day. Stay safe and stay healthy.